This is Heliox, where evidence meets empathy. Independent, moderated, timely, deep, gentle, clinical, global, and community conversations about things that matter. Breathe easy. We go deep and lightly surface the big ideas. Welcome back, everyone, to the deep dive. Today, we're going to kind of get into something. I mean, we all know this is important, healthcare in the U.S., but not just, going to the doctor, but the whole financial side of it.
Right.
Are we really getting our money's worth?
Yeah.
So we've got three sources kind of guiding us today. First, we've got the survey. It actually shows how much people are borrowing for medical expenses. It's pretty crazy.
Yeah.
Then we'll look at, how long Americans live compared to other countries. And we'll also look at how much we spend on healthcare compared to them. And finally, we've got an analysis of how U.S. healthcare spending has changed over time. And we'll compare that to other, rich countries.
Right.
So one thing that really jumped out at me, and I think it will at you too, is that Americans borrowed $74 billion last year just for healthcare. Billion. That's with a B.
Huge.
So to help us really understand this, we have our expert here.
Yeah, that $74 billion number is definitely, makes you think. But, it's not just people without insurance.
Oh, really?
Yeah. So this West Health Gallup survey, they found that even with insurance, 12% of Americans, that's 31 million people, had to borrow money for healthcare just last year.
So even if you have insurance, you could still end up in debt.
Exactly.
That's a little scary.
Yeah, and over half of those people, they borrowed $500 or more, and 14% borrowed, get this, $5,000 or more.
Wow. That's a lot.
That's not, pocket change.
Yeah.
And what's really concerning is this worry about medical debt. It's everywhere, all income levels,
Okay.
Even people with Medicare. So this isn't just a problem for the poor. It's a system-wide thing.
It's almost like everyone's worried about medical debt no matter how much money they make.
Right.
And it's not just individuals, right? It's whole families. The survey found that if you've got kids under 18, you're twice as likely to borrow for healthcare than people without kids.
Yeah, that's a huge point. Because this debt doesn't just vanish. It can really impact families, mental well-being, their ability to save for the future, or even things like housing and education.
It makes you think, if we're spending so much, are we actually getting healthier? So this brings us to our next source, which compares how long Americans live and how much we spend compared to other, developed countries.
Yeah, the data's not pretty. Even though we spend the most per person on healthcare in the world, we actually have the shortest lifespan compared to similar countries. Last year, 2023, the average American lived to be 78.4 years old. That's 4.1 years less than the average of other developed nations.
4 years. That's a huge gap. It's like we're throwing money at the problem but not getting the results. And it's not just at birth. It's even when you look at older ages, like 65.
Yeah.
So I'm curious, what are some explanations for this? Why are we spending so much but not living longer?
Well, there's no simple answer.
Yeah.
But a lot of it comes down to how healthcare is organized and delivered in the U.S. It's very different from other countries.
So it's not just about the amount we spend, but how we spend it.
Exactly. So let's look at the trends in how we spend on healthcare, over time. We'll use that last source, which analyzes the past few decades.
All right, let's dive into those spending patterns. What's going on there?
So for decades, U.S. healthcare spending has been increasing faster than our economy. It has slowed down a bit lately, but we're still spending more than other developed countries. It's like a train that won't slow down.
But doesn't that mean we could be doing things better, like finding ways to spend smarter, and get more for our money?
Absolutely.
Yeah.
To really understand why our spending is so high, we need to look at the main things driving it. Things like administrative costs.
Yeah. Okay, those administrative costs. How much of our healthcare money is actually going to paperwork and not to actual doctors and care?
Well, the studies show that administrative costs in the U.S. system are way higher than other developed countries. It's like this crazy maze.
Oh.
Yeah, and figuring out the system can be just as hard as dealing with the actual medical problem.
So a lot of our healthcare money is getting lost in this bureaucracy.
Right, and think about all the people and resources needed to process those claims. Payments and figure out all those insurance rules. It all adds up. And who pays for it? The patients and employers. It's part of the reason those bills are so high.
It's frustrating to think that all that extra money could be going to patient care or research.
Yeah. And speaking of inefficient spending, we can't forget about prescription drug prices.
Oh yeah, the elephant in the room. Everyone knows prescription drugs cost a fortune in the U.S.
They do. And it's a huge reason why overall healthcare spending is so high.
Okay, so we're spending a ton, but not getting healthier. Plus, a bunch of our money is going to administrative stuff, and then there's the whole drug price problem. Why are medications so expensive here compared to other developed countries?
Well, it's complicated, but a big reason is that our government doesn't really have the power to negotiate drug prices. Yeah, in a lot of other developed countries, the government actually steps in and negotiates prices with those pharmaceutical companies.
Wouldn't that, hurt innovation, though? I mean, wouldn't drug companies make less money for research and stuff?
That's a valid point for sure. But lots of countries have found ways to keep prices in check without hurting innovation.
How do they do that?
Well, they use different strategies. Like, they'll evaluate how cost-effective a new drug is. Basically, they want to make sure it's worth the price tag.
So they're making sure new drugs are actually valuable, not just expensive. What about those rebates and discounts we hear about all the time?
Rebates and discounts are a whole other can of worms.
Yeah.
It's this really complex and kind of secretive system involving drug companies, insurance companies, and these things called pharmacy benefit managers.
Sounds like a mess.
Kinda.
Do these rebates and discounts actually help people save money?
Well, they're supposed to. But the way it works now, it seems like insurance companies and those benefit managers are making out better than the patients.
So basically, we have this lack of transparency, the government can't negotiate, and rebates and discounts don't really help patients that much. No wonder people are upset about drug prices.
It's definitely frustrating for people who need these medications.
Absolutely. And it goes back to that whole efficiency thing we were talking about before. How inefficient is our healthcare system, really? What are some examples?
One thing is all the unnecessary tests and procedures.
You mean when doctors order extra tests just in case?
Yeah, sometimes it's because they're worried about getting sued. It's called defensive medicine.
So fear of lawsuits is actually making healthcare more expensive.
It's part of it, yeah. Another problem is the way we pay for healthcare. It's called fee-for-service, which means doctors get paid for every service they provide, not necessarily for keeping people healthy.
So it's the more they do, the more they get paid, even if it's not really necessary.
Right, and that kind of encourages treating illnesses after they happen instead of focusing on prevention.
Which is more expensive in the long run, right?
Exactly. It's less effective and way more expensive.
So it seems like we need a huge change, moving away from just reacting to problems and towards a more proactive, health-focused system.
I think a lot of people would agree with you there. It's about rewarding providers for keeping people healthy, not just for treating them when they're sick.
Makes sense. So what are some things we could actually do to change things? I mean, are there any solutions out there that could actually make a difference?
There are some promising ideas. One big one is price transparency. A lot of experts think that if people knew the real costs up front, it would create more competition and drive prices down.
Yeah, transparency seems like a no-brainer. It's hard to make good decisions when you have no idea how much something costs.
Right, and some states have actually started doing this. They have websites where you can compare prices for common procedures.
Interesting. That sounds like a good step. What about the crazy drug prices? Are there any solutions for that?
Well, one idea is to let Medicare negotiate drug prices.
Medicare, like the government program for seniors?
Yeah, and it works in other countries. They've saved a lot of money by doing that.
But wouldn't drug companies hate that?
They're not fans of it, no.
Why not?
Well, they argue that it would hurt their ability to develop new drugs.
It sounds like a tough situation. Trying to find a way to keep costs down, but also keep those new drugs coming.
It is. It's a tough balance. And speaking of balancing acts, another thing we could do is move away from that fee-for-service thing we talked about.
Yeah. Okay, what are some alternatives?
One is called value-based care. It's about paying doctors for good outcomes, like keeping people out of the hospital.
So basically, they get rewarded for keeping people healthy.
Exactly.
That sounds way better. Is anyone actually doing this?
Yeah, there are some healthcare systems doing it. Some use bundled payments where they get a set amount to take care of a patient with a specific condition.
So instead of getting paid for every little thing, they get one payment to cover everything.
Right, which encourages them to be more efficient. They get to keep the savings if they come in under budget.
That's smart. Any other innovative ideas out there?
Yeah, there are these things called accountable care organizations, or ACOs.
What are those?
It's basically when different providers, like doctors and hospitals, team up to coordinate care for a group of patients.
So it's about making sure everyone is on the same page and the patient gets the best care possible.
Yeah, and they're responsible for the quality and the cost of care. They also share any savings.
So it's about working together and making sure everyone benefits. It seems like all these ideas are about focusing on quality over
You
quantity.
got it. It's about moving away from a system that rewards sickness and towards one that rewards health.
That's a huge shift. But even with all these great ideas, there are still some basic problems we need to fix. Like, what about people who can't even afford to see a doctor in the first place?
That's a really important point. We can have the best payment models in the world, but if people can't access basic health care, we're not going to see real improvement.
So we need to make sure everyone can get the care they need, right?
Absolutely. That means investing in primary care and mental health care. Those are the foundations of a good healthcare system.
It's like building a house. You need a strong foundation first.
Exactly. If we want to see real, long-lasting improvement, we need to invest in primary care, mental health care, and social support services.
So we've talked about how expensive and inefficient our healthcare system is, and we've talked about some potential solutions. What stands out to you? What do you think is the most important thing we need to focus on?
That is a tough question. There's so much going on with our healthcare system. It's like, where do you even begin? But I guess if I had to pick one thing, it would be those incentives. The way the system is set up now, it rewards doing more instead of doing better. We need to change that if we want to get costs down and see people getting healthier.
It's like we've been using the wrong tools for the job. Instead of just treating people after they get sick, we should be helping them stay healthy in the first place.
Right. It's about being proactive, not reactive.
Okay, so we've talked about all these big problems, but what can regular people do? I mean, it all seems so huge and complicated. It's easy to feel like you can't really make a difference.
I get that. But I think we all have a part to play. One thing you can do is be a smart consumer.
What do you mean?
Like, learn about your healthcare options. Don't be afraid to shop around, compare prices, ask questions. You have to be your own advocate.
So basically, do your research. The more you know, the better choices you can make.
Exactly. And another thing you can do is get involved. Support organizations that are fighting for better healthcare. Or contact your representatives and let them know what you think.
So make your voice heard.
Right. Change doesn't happen overnight, but it starts with people speaking up and demanding better.
This has been a really eye-opening conversation. Thanks for breaking it all down for us, but we've only scratched the surface here, right?
Oh yeah, there's a ton more to learn. I encourage everyone to keep digging into these issues. You can start with those reports we mentioned from West Health Gallup and the Kaiser Family Foundation. They're really interesting.
And don't forget about talking to people, your friends, family, colleagues. Hearing about their real-life experiences can really bring this whole issue to life.
That's so true. It reminds us that these aren't just abstract policies. They affect real people every day.
It's about making sure everyone has access to good, affordable health care, no matter who they are or where they live.
Couldn't have said it better myself.
Well, that about wraps it up for our deep dive into the U.S. healthcare system. Hope you learned something new.
Me too.
Stay curious and keep learning.
Thanks for listening today. 4 recurring narratives underlie every episode: boundary dissolution, adaptive complexity, embodied knowledge, and quantum-like uncertainty. These aren't just philosophical musings, but frameworks for understanding our modern world. We hope you continue exploring our other podcasts, responding to the content, and checking out our related articles at helioxpodcast.substack.com.